Welcome to EPG Pathshala. Myself, Professor Mini Sheth from the Department of Foods and Nutrition, Faculty of Family and Community Sciences, the MS University of Baroda. Let us today learn on eating disorders amongst adolescents. Despite the importance of healthy eating during adolescence, many adolescents' diet do not meet national nutrition guidelines. Thus, there is a strong need to review dietary intakes and adequacy of adolescents' diets, factors influencing adolescent eating behaviors and common eating behaviors of adolescents. Obesity, disordered eating and eating disorders are the major public health problems amongst adolescents because of their high prevalence and the potentially serious physical and psychological consequences. Understanding factors influencing these eating and weight related problems and identifying effective prevention strategies are critical issues. One important question that relates to the role of dieting. Now, the objectives of this module are, after going through this module, you will be able to understand clearly the various types of eating disorders amongst adolescents, identify the various warning signs and symptoms in development of eating disorders amongst adolescents, and learn about the consequences of various eating disorders and key strategies to improve healthy eating behaviors in adolescents. First, let us try to understand the factors influencing eating disorders. The conceptual model of eating pattern and behaviors of adolescents are influenced by many factors, including peer influences, parental modeling, food availability, food preferences, cost, conveniences, personal and cultural beliefs, mass media and body image. The conceptual model of multiple factors that influence eating behaviors of adolescents are developed. The model depicts three interacting levels of influence which impact adolescent eating behaviors. One, personal or individual, second, environmental and macro systems. Personal factors that influence eating behaviors include attitude beliefs, food preferences, self-efficacy and also biological changes. The environmental factors include the immediate social environment such as family, friends and peer networks, and other factors such as school, fast food outlets, social and cultural norms. The macro system factors, which include food availability, food production and distribution system, and mass media and advertisement play a very important role and a more distant and indirect role in determining food behaviors, yet they can exert a powerful influence on eating behaviors. Describing the emergence of eating disorders in history, Perry Jones refers to morbid states involving food refusal or relentless reduction of food intake and of gorging followed by vomiting being mentioned in literature as far back as ancient Greek and Rome. Judging by the facility which the dictionary and lexicon references have been gathered from the 16th century onwards, it is evident that such disorders of appetite were sufficiently frequent and familiar to warrant definition in both general and medical works. The current patterns of psychopathology, anorexia nervosa and bulimia nervosa, which are dominated by weight and shape concerns, are indeed relatively recent in so far as such preoccupations cannot be traced back positively before the mid-19th century. Many eating disorders begin during adolescence, but psychologists and doctors have found an increasing number of young children and older adults diagnosed with these illnesses. The more quickly an eating disorder is diagnosed and effective treatment begins, the greater the chances of recovery. It is not uncommon for the symptoms of eating disorder to change over a period of time. However, half of the people originally diagnosed with the restricting type of anorexia later develop bulimic symptoms according to study from Harvard University. Someone who primarily binge eats can transition to most likely restricting their intake later. As well, a person can recover from one eating disorder but relapse later with a different eating disorder, especially if under or inadequately treated. Eating disorder can be deadly. Heart failures and suicides are two of the most common causes of death in people with eating disorders. Despite this, most people with eating disorders eventually recover. When Harvard psychologists followed a group of people initially diagnosed with anorexia or bulimia for 20 years, they found that 2/3 ultimately fully recovered. Recovery can take a long time and lots of hard work, but it is possible. Bulimia nervosa is one of the eating disorders, and it's a serious, potentially life-threatening eating disorder. It is characterized by a cycle of binging and compensatory behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. The symptoms of binge eating include frequent episodes of consuming large amount of foods followed by behaviors to prevent weight gain such as self-induced vomiting, a feeling of being out of control during binge eating episodes, self-esteem overly related to body image. According to the DSM-5, the official diagnostic criteria for bulimia nervosa are recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following: eating in a discrete period of time, that is within any 2 hours period, an amount of food that is definitely larger than most people would eat during similar period of time and under similar circumstances. A sense of lack of control over eating during the episode, for example, a feeling that one cannot stop eating or control what or how much one is eating. Recurrent inappropriate compensatory behavior in order to prevent weight gain such as self-induced vomiting, misuse of laxative, diuretics or other medications, fasting or excessive exercises. The binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. Self-evaluation is unduly influenced by body shape and weight. The disturbances does not occur exclusively during episodes of anorexia nervosa. Warning signs and symptoms of bulimia nervosa include the chance of recovery increases the earlier the bulimia is detected. Therefore, it is important to be aware of some of the warning signs of an eating disorder. These include emotional and behavioral signs of bulimia. In general, behaviors and attitudes indicate that weight loss, dieting and control of food are becoming primary concern. Evidence of binge eating, including disappearance of large amount of food in short periods of time or lots of empty wrappers and containers indicating consumption of large amounts of food, evidence of purging behaviors including frequent trips to bathroom after meals, signs and smells of vomiting, presence of wrappers or packages of laxative or diuretics, appears uncomfortable eating around others, skip meals and takes small portions of food at regular meals, steals or hoards food in strange places, drinks excessive amounts of water or non-alcoholic or non-caloric beverages, uses excessive amount of mouthwash, mints and gums, hides body with baggy clothes, maintains excessive rigid exercise regime despite weather, fatigue, illness or injury due to the need to burn off calories, looks bloated from fluid retention, shows extreme concern with body weight and shape, frequent checking in the mirror for perceived flaws in appearance, extreme mood swings, physical signs of bulimia, noticeable fluctuations in weight, both up and down, stomach cramps, other non-specific gastrointestinal complaints such as constipation, acid reflux, etc. There are also menstrual irregularities observed, missing periods or only having a period while on hormonal contraceptives, and this is considered as a true period. Difficulties in concentrating is also observed, abnormal laboratory findings which show anemia, low thyroid and hormone levels, low potassium levels, low blood cell counts, slow heart rates. Other symptoms include dizziness, feeling cold all the time, sleep problems, cuts and calluses across the top finger joints, a result of inducing vomiting. Dental problems are also common and such as enamel erosion, cavities and tooth sensitivity, dry skin and nails, swelling around the areas of salivary glands, fine hair on body, thinning of hair on head, dry and brittle hair, cavities or discoloration of teeth from vomiting, muscles weakness, yellow skin in context of eating large amounts of carrots, sometimes cold mottled hands and feet, swelling of feet, poor wound healing, impaired immune functioning have also been observed. Anorexia nervosa is an eating disorder which is characterized by weight loss or lack of appropriate weight gain in growing children. Difficulties in maintaining an appropriate body weight for height, age and stature, and in many individuals, distorted body image. People with anorexia generally restrict the number of calories and type of food they eat. Some people with the disorder also exercise compulsively, purge via vomiting and laxatives, and binge eat. Anorexia can affect people of all ages, genders, sexual orientations, races and ethnicities. People in northwestern areas such as rural China and Africa have also been diagnosed with anorexia nervosa. Although the disorder most frequently begins during the adolescence, an increasing number of children and older adults are also being diagnosed with anorexia. Nor does a person need to be emaciated or underweight to have anorexia. Studies have found that larger bodied individuals can also have anorexia, although they may be less likely to be diagnosed due to cultural prejudice against fat and obesity. To be diagnosed with anorexia, according to the DSM-5, the following criteria must be met: restriction of energy intake relative to the environment's requirements leading to significantly low body weight in context of age, sex, developmental trajectory and physical health. Number 2, intense fear of gaining weight or becoming fat even though underweight, disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape or self-evaluation, or denial of the seriousness of the current low body weight. Even if all the DSM-5 criteria for anorexia are not met, a serious eating disorder can still be present. A typical anorexia include those individuals who meet the criteria for anorexia but are not underweight despite significant weight loss. Research studies have not found a difference in the medical and psychological impacts of anorexia and atypical anorexia. Warning signs and symptoms of anorexia nervosa. The chance of recovery increases the earlier an eating disorder is detected. Therefore, it is important to be aware of some of the warning signs of an eating disorders. Number 1, emotional and behavioral signs of anorexia nervosa, dramatic weight loss, dresses in layers to hide weight loss or stay warm, is preoccupied with weight and food and calories and fat grams and dieting, refuses to eat certain foods, progressing to restrictions against whole categories of food, for example, no carbohydrates, etc., makes frequent comments about feeling fat or overweight despite weight loss. They generally complain of constipation, abdominal pain, cold intolerance, lethargy and or excessive energy, denies feeling hungry, develops food rituals, for example, eating foods in certain orders, excessive chewing, rearranging food on a plate, cooks meals for others without eating, consistently makes excuses to avoid meals times or situations involving food, expresses a need to burn off calories taken in, maintains an excessive rigid exercise regime despite weather, fatigue, illness or injury, withdraws from usual friends and activities and becomes more isolated, withdrawn and secretive, seems concerned about eating in public and has limited social spontaneity. Such people also resist or is unable to maintain a body weight appropriate for their age, height and build. Such people also have intense fear of weight gain or being fat even though underweight, has disturbed experience of body weight or shape, undue influence of weight or shape on self-evaluation or denial of the seriousness of low body weight. Post-puberty female losses menstrual period, feels ineffective, has strong need for control, shows inflexible thinking, has overly restrained initiative and emotional expression. Such people also showed physical signs of anorexia nervosa such as stomach cramps, gastrointestinal complaints such as constipation, acid reflux, menstrual irregularities, amenorrhea, irregular periods or having only a period on a hormonal contraceptive, and difficulties in concentrating, abnormal laboratory findings such as anemia, low thyroid hormonal levels, etc. Such people also feel cold all the time, they have sleep problems, cuts and calluses on the top of the fingers resulting in inducing vomiting. Dental problems are also very common in such individuals due to enamel erosions and also dry skin and dry brittle nails. Swelling around the areas of salivary glands, fine hair on the body, thinning of the hair on the head, dry and brittle hair. These symptoms are almost similar to those found in bulimia. Yellow skin in context of eating large amounts of carrots has also been observed. Cold mottled hands and feet of swelling of feet, poor wound healing. Binge eating disorder is a severe life-threatening and treatable eating disorder characterized by recurrent episodes of large eating quantities of food, often very quickly to the point of discomfort, a feeling of loss of control during binge, experiencing shame, distress or guilt afterwards, and not regularly using unhealthy compensatory measures. To counter the binge eating, it is most common eating disorder in United States. Binge eating disorder, commonly referred to as BED, is one of the newest eating disorders formally recognized in the DSM-5 before the most recent revision in 2013, BED was listed as a subtype of EDNOS, now referred to as OSFED. The formal diagnostic criteria are: number 1, recurring episodes of binge eating. An episode of binge eating is characterized by both of the following: eating in a discrete period of time, that is within any 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances, a lack of control over eating during episode, that is feeling that one cannot stop eating or control what or how much one is eating. The binge eating episodes are associated with 3 or more of the following: number 1, eating much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, and feeling disgusted with oneself, depressed or very guilty afterwards. Marked distress regarding binge eating is present. The binge eating occurs on average at least once a week for 3 months, and the binge eating is not associated with recurrent use of inappropriate compensatory behaviors as in bulimia nervosa, and does not occur exclusively during the course of bulimia nervosa or anorexia nervosa. The chance for recovery increases the earlier the binge eating disorder is detected. Therefore, it is important to be aware of some of the warning signs of an eating disorders: emotional and behavioral signs of binge eating disorders, evidence of binge eating, including disappearance of large amounts of foods in short periods of time, or lots of empty wrappers and containers indicating consumption of large amounts of food, appears uncomfortable eating around others, any new practice with food fad diets, including cutting out entire food groups, no sugar, no carbs, no dairy, vegetarianism, veganism, and fear of eating in public or with others. Such people also steal or hoard foods in strange places, create lifestyle schedules or rituals, or make time for binge sessions, withdraws from usual friends and activities, and these people also frequently diets, and their diets show extreme concern with body weight and shape. Frequent checking in the mirror for perceived flaws in appearance has secret recurring episodes of binge eating. Eating in a discrete period of time an amount of food that is much larger than most individuals would eat under similar conditions. They feel lack of control over eating ability or to stop eating. Disruption in normal eating behaviors, including eating throughout the day, no planned meal times, skipping meals or taking smaller portions of food at regular meals, engaging in sporadic fasting or repetitive dieting, developing food rituals, that is eating only a particular food or a particular food group, for example condiments, excessive chewing, not allowing foods to touch, and eating alone out of embarrassment at quantities of food being eaten. Such persons also feel disgust, depressed, and feel guilty after overeating. They have generally fluctuations in weight, they have feelings of lowest self-esteem. The physical signs of binge eating disorder include fluctuations in their weight, both up and down, stomach cramps, and other non-specific gastrointestinal complaints such as constipation, acid reflux, etc. Such individuals also experience difficulties in concentrating, avoidant restrictive food intake disorder. This is another type of disorder in which and it's a new diagnosis in the DSM-5 and was previously referred to as selective eating disorder. And it is similar to anorexia in that both disorders involve limitations in the amount and or types of food consumed, but unlike anorexia, AFRID does not involve any distress about body shape or size or fears of fatness. Although many children go through phases of picky or selective eating, a person with ARFID does not consume enough calories to grow and develop properly, and in adults to maintain the basic body function. In children, this results in stalled weight gain and vertical growths, whereas in adults this results in weight loss. ARFID can also result in problems at school or work due to difficulties in eating with others and extended times needed to eat. According to the DSM-5, ARFID is diagnosed when in eating or feeding disturbances, for example, apparent or lack of interest in eating or food or avoidance based on the sensory characteristics of food, concerns about aversive consequences of eating, as manifested by persistent failure to meet the appropriate nutritional and energy needs associated with one or more of the following. Number 1, significant weight loss or failure to achieve expected weight gain or faltering of growth in children. Number 2, significant nutritional deficiency, also dependence on enteral feeding or oral nutritional supplements may take place. Also, there may be marked interference with psychosocial functioning. Disturbance is not better explained by lack of available food or by an associated culturally sanctioned practice. The eating disturbance does not occur exclusively during the course of anorexia nervosa or bulimia nervosa, and there is no evidence of a disturbance in the way in which one's body weight or shape is experienced. The eating disturbance is not attributable to concurrent medical condition or not better explained by any other mental disorder. When the eating disturbance occurs in context of other condition or disorder, the severity of eating disturbance exceeds that routinely associated with condition or disorder and warrants additional clinical attention. Hence, to summarize, today we have seen the major eating disorders including anorexia nervosa and bulimia and the bed eating disorders, and also regarding their symptoms and how these disorders can be controlled and prevented. Thank you.